Hi there, and a warm welcome to another episode of Today's Parent, where we connect you with experts and provide you with information to make your parenting journey a bit more easier. I'm your host, Christine Casina. In today's show, we are talking about common ailments when it comes to pregnancy. To make us understand more, we have Dr. Kakuti, who's a gynecologist and obstetrician. Dr. Kakuti.
Thank you, welcome.
A pleasure to have you. For a parent who's watching right now, a mom who's pregnant, they have so many concerns, so many questions they have. And the one thing I'm sure they're thinking to themselves, when it comes to, the general ailments, just you want to have a healthy pregnancy. But here and there, ailments happen. Let's take it trimester by trimester when it comes to common ailments in pregnancy.
So in every trimester, there are different challenges a woman will face. But pregnancy, we say, is not a sickness. But whenever a patient presents to you with a complaint, take it seriously. Don't assume that, it's pregnancy, it's normal. Older women will tell them, nganga nayo, it's normal. No, take it seriously and listen to them. So in first trimester, most women, even before they discover they're pregnant, they'll tell you, I've been feeling unwell. I'm feeling nauseous, I'm vomiting, and in my head I'll be like, ding, ding, you're pregnant, So they get nauseous. And some even, their favorite foods become their worst enemy that
Right.
day. Your husband's cologne, which you loved, becomes your worst nightmare.
No.
Your both bath and body works, your shower gel.
You can't stand it.
Yes, you can't stand the food that is being cooked in the kitchen. And that's one of the signs. The other women will complain about vomiting.
Okay.
And vomiting can be from just in the morning, what is called morning sickness, to very severe vomiting, which now becomes a medical condition.
Right.
The other common ailment is bloating.
Before you move to bloating, let's delve into nausea and vomiting. When do you tell that your morning sickness is excess?
So if you are vomiting, we can't really see how many times a day.
Yeah.
But if it's making you not retain anything.
Right.
To a point whereby you can't even retain water. So you eat food, you eat a fruit, even a small amount of, you take a glass of water and you throw and you
throw
vomit.
up.
That becomes a problem.
Okay.
And that becomes detrimental because you may get dehydrated. Remember, in pregnancy, your calorie intake has to go up in terms of how you're eating, your fluid intake. So if you are not able to retain anything, then you're looking at dehydration, which now becomes a danger to you as a mother.
Right.
Yes.
So when it comes to excess vomiting, does it happen mainly in the first trimester, or as we move on, it can also happen in the second or third trimester?
So ideally, nausea and vomiting should physiologically in pregnancy go up to around 14 to 16 weeks.
Okay.
Now, when you get pregnant, the hormone that comes into play is beta-HCG. So when we're doing a pregnancy test, we're checking for beta-HCG.
Right.
So beta-HCG should double every 48 hours. And the higher it goes, the more nauseous and vomiting you'll have.
Okay.
If you have a twin gestation, triplets, then even becomes more. So if a patient who vomits like really an abnormal amount, what we'll consider out of the norm in vomiting in normal pregnancy, then we'll query, is she carrying twins? Is she carrying triplets? We may question that. But the hormone responsible is beta-HCG.
Okay.
So if your pregnancy is normal, we won't say, let's measure beta-HCG. The scan is normal. We just say, you know what? It should wear off by 14 to 16 weeks.
Right.
Unfortunately, there are some who may vomit longer. Yeah.
Okay. Then you mentioned bloating.
Bloating, yeah. So when you get pregnant, the hormone that also comes to play is progesterone. So for many women, even before their during their menstrual cycle, the second phase before their periods, they say, I'm getting bloating, the premenstrual syndrome.
Right.
And they tell you, I'm feeling bloating. Others get a lot of cramps and stuff like that. So that same hormone in pregnancy, I'm feeling crampy, Others may get, because the uterus actually contracts during pregnancy. And these contractions are called Braxton Hicks. Some of them may be a bit severe.
Okay.
So the patient tell you, I've been having some cramps. As long as they're not leading to labor, either we can put you on a painkiller or something like that, but we may have to reassure you that it's normal to have the cramps. Either some of them we may have to put them on a mild painkiller like paracetamol.
Okay.
We are very careful about what we'll give you.
Right.
Yes.
Backaches, do they happen in the first trimester or throughout? I'm sure it gets worse in the third trimester, but I don't know about the first trimester.
It varies from one patient to another. Pregnancy is amazing. It's this physiological normal thing that a woman should experience. And because it's not a sickness, it's expected that you don't have issues. Some people have issues even from as early as first trimester. So in first trimester, we're not able to explain why the backache is there. But we will ask you questions. For example, have you had an injury?
Yeah.
Have you had a strain? Have you just done some yoga or Pilates and maybe overstretched yourself.
Right.
So we do ask such questions. In second to third trimester, as the abdomen is pulling forward, your back dimensions are going to change. So what happens, some women tell you that when the back arches more, they'll tell you that I'm having a bit of discomfort.
Okay.
We are not going to, if it's normal, we're not going to expose you to x-rays. We'll tell you it's normal. So sometimes I'll tell my patients, tell your husband to give you a massage. But there are pregnancy massages that are recommended, or maybe do some exercise. Those who actually exercise hardly have issues.
Right.
Yes, but it's a common problem. Then another symptom of when someone in labor, they'll tell you, I'm having more backache than pain here, and it's normal.
Right.
Yeah.
Constipation?
Oh, God. So constipation is one of the most annoying things for patients because you feel like going, but it's not coming out. So she tells you, I'm just feeling something is there, nataka kwenda, and I can't, I'm not able to pass through. And because also of progesterone. So when you're pregnant, progesterone is a hormone that causes smooth muscle relaxation.
Right.
So the intestines relax. So whenever we eat food and food comes from the stomach into the intestines now to get out as feces, what happens is the intestines do what is called peristalsis. They push everything. They do this. In pregnancy, that becomes slower. So when they eat food, unlike you and I, food will actually leave the stomach in after 2 hours or so. For pregnancy, food stays in the stomach for a longer time.
Okay.
So when they eat, they tell you, I'm still feeling the food hasn't gone down. And it's normal.
Okay.
It's normal. Others will tell you, I'm taking more days to pass stool. And so if you're not well hydrated, the more stool stays in the intestines, the more water leaves the intestine. So it becomes harder.
Okay.
So we normally encourage them to we give them certain remedies on what to do.
Right.
Yes.
Shall we move to trimester 2?
Yes.
Okay, so what are the common ailments when it comes to trimester 2? I don't know if heartburns is more prevalent in trimester 1, 2, 3, or 2, 3.
Some of them you really can't categorize in trimesters, but heartburn is so common. And so what happens is it's believed that the acid that normally digests food in the stomach, hydrochloric acid, is more during pregnancy. Some women do not experience it at all, but for me, majority of my patients will tell me I'm having heartburn.
Okay.
What we normally make sure is if it's accompanied with vomiting, that you're not vomiting blood. If it's just heartburn, then we give you a remedy for that.
Okay.
And then also advise that if there's food that is making you have heartburn, you can avoid that food. There are many foods you can avoid in pregnancy if you don't feel like eating them. And there are other alternatives that can replace what you really need to eat and make your nutrition great.
Okay.
Yeah.
So we've talked about the common ailments, when it comes to complications, when it comes to pregnancy, the common ailments. Let's move to the more complicated ones. Which ones come to mind?
Wow, complications in pregnancy, the most common that we encounter is high blood pressure.
High blood pressure.
Yes.
What causes high blood pressure in pregnancy?
So there are several risk factors that cause high blood pressure in pregnancy, and many of them are one of them is known to be, for example, age. So women above 35 years, you're considered to be an elderly mom, especially if it's your first baby. So
Did you say 35?
Yeah, unfortunately. Yes, age above 35. But the thing is, a lot of risk factors don't follow the rules with certain patients. Also, if you get your first baby at a very early age, so extremes of age, teenage pregnancies as well as elderly, but we call them elderly moms. Yeah, elderly moms above 35. I also don't like the word 35. I don't like the number 35. Then the other risk factor is if already you have high blood pressure, if you're a non-hypertensive patient, you already have diabetes. If you have a family member who had high blood pressure in pregnancy, there is a possibility of you getting it. Other one which is proven here and there is a theory that if your husband's grandmother had blood pressure, then there's a chance that you may get it. The other risk factor for high blood pressure also is if you're carrying multiple pregnancies. If you have twin gestation, more than one baby, then there's a high risk of you having high blood pressure in pregnancy.
Right.
If you have a large placenta. So patients who have what is called rhesus, who are rhesus negative. So it means your blood group is, you've heard about the rare blood groups?
Yes.
A, B, O, AB, which are negative. So if you have a complication called rhesus incompatibility, you tend to have a larger placenta. That also puts you at risk of having high blood pressure in pregnancy.
Right.
Yeah.
How about...
And also being overweight, obesity.
Oh, we should cover that as well.
Yes, having a BMI above 30 puts you at risk of having high blood pressure in pregnancy as
well.
Yes.
All right. The other one that I've heard of, I don't know how common it is, gestational diabetes. What does that mean?
Yeah. So gestational diabetes basically it's not as common. But when you get a patient, it's a patient you have to be very, very keen on.
All right.
So what happens in pregnancy, there's another hormone called human placental lactogen, which peaks at between 24 and 26 weeks. So what happens, it interferes with how insulin is supposed to work. So when you eat food, ideally, and then the food is digested and the glucose enters the bloodstream, insulin checks in to now bring the sugars to a normal level.
All right.
So what happens is human placental lactogen challenges the work of insulin. So all women between 24 and 26 weeks of pregnancy have to be checked if they may be developing diabetes in pregnancy.
Right.
It's not very common.
Okay.
So the risk factors are almost similar to those of those who have high blood pressure. If you have if you have a family history of diabetes, if you're overweight, if you're also especially, but this one is in extremes of age, more of women who are above 35.
Okay.
So it is a condition that is, if I look at it between high blood pressure and diabetes, I'd rather manage high blood pressure. Diabetes is very sensitive. You have to be very careful about how you manage them. And in diabetes, the best way to manage that patient is with a diabetician. So get a physician who is a diabetic specialist.
Okay.
There's no heroism in medicine. Always co-manage your patient as a multidisciplinary team.
Okay.
Yeah.
So in this case, a mother would need to work with you, the gyna, and
a diabetic specialist.
Right.
Yes, and we have quite a number of great ones in the country.
Okay.
Yes.
Preeclampsia. Another, hopefully it's not a common one, but I've heard of it, and I know a lot of moms have heard of it as well. Preeclampsia, what is it?
So preeclampsia and high blood pressure in pregnancy, same thing.
Right.
It is specific. So we normally categorize high blood pressure in pregnancy into several types. So there's what is called essential. There are those who are already hypertensive, and we normally advise, if you are already hypertensive, you're being followed up by a physician, tell them, I'm planning to get pregnant. Because there are certain medications you may be on when you're not pregnant that we don't allow you to take when you're pregnant. So we have to liaise with the physician. They tell me she wants to get pregnant, and I'll say change her treatment from these drugs because they are contraindicated or not allowed in pregnancy, as they may harm the baby. Preeclampsia specifically sets in after 20 weeks of pregnancy. If you have high blood pressure before pregnancy, then we suspect you may have been hypertensive before pregnancy. But preeclampsia is specific to after 20 weeks of pregnancy. So when you come to the clinic, we'll find that your high blood pressure is very high. We take a urine test. We may find what are called proteins in your urine. Your kidneys are allowing proteins to pass through.
Okay.
Other symptoms and also other blood tests have to be done to confirm that the high blood pressure in pregnancy, especially preeclampsia specifically, that causes organ damage. It can cause issues to your liver and to your kidney.
Wow.
So tests have to be done.
Okay.
So and then there's another one which is called now eclampsia. Eclampsia is when you have preeclampsia and then that leads to convulsions. So that now becomes,
no.
Yes, very dangerous, very dangerous. So you have to monitor, and every time a mother comes to clinic, her blood pressure must be checked. Her urine must be checked. Her weight gain must be checked. A patient may come to you, you may notice a patient who, I'm like, 2 weeks ago I saw you look like you were around 60 kilos. Now you look like you're 80. There's a certain amount of weight gain. So if they've gained weight, they're retaining water, make sure their blood pressure is okay. A patient who complains about headaches, the first thing I tell them is, come and let's check your blood pressure, because you may have a headache because of having high blood pressure in pregnancy. So preeclampsia is a detrimental condition if not looked after in pregnancy. You must be followed up keenly. The baby must be followed up keenly to prevent complications.
All right.
Yeah.
Thank you for sharing. We are going to take a short break. In today's episode, we are talking about complications when it comes to pregnancy. If you have any questions for Dr. Kakuti, please send us an SMS and we'll find a way to get back to you. We'll be right back after this short break. Welcome back to today's episode of Today's Parent, where we are talking about common ailments when it comes to pregnancy. And in studio today, we have Dr. Kakuti. Thank you for the SMSs you've sent so far. Very, very interesting. Some of the questions you're asking us that you feel we need to cover, ailments such as thrush, incontinence, and there's somebody asking, there's Abdallah asking when it comes to a general question. He's asking, is sex something I need to abstain from so that I don't cause any harm to my wife? Dr. Kakuti.
Yes.
So which one do we start with? Do we start with thrush, incontinence? Yes. Which one do you want to start with?
We can actually talk about both of them.
Right.
So it's not really incontinence, but many women complain about having to pass urine, and this is more common in the third trimester. So remember the uterus lies right behind the bladder.
Yes.
So as uterus grows bigger, it actually sleeps on the bladder. So a part of it actually, so a small amount of urine, most women are just looking for a bathroom, it is normal.
Okay.
But if you're passing urine and maybe you feel it's stinging or it's burning, or maybe it's, maybe too frequent, I've just taken water for 5 minutes, I'm going to the bathroom, then maybe you get a test. But it's recommended that every woman during every clinic visit, your urine actually should be checked.
Right.
And we check for protein to look for blood pressure. We check for if you're passing glucose, because that could tell us you're getting high blood pressure, or infection for parcels. So incontinence is common. Others get what is called stress incontinence. So as the uterus has pushed on the bladder, you're with your friends and you're talking and you laugh and a little bit urine passes. Don't take it badly, really. Just continue laughing. The other common one is that UTIs are very common, urinary tract infections, together with candidiasis.
It's important to cover that.
Yes. So when you're pregnant, actually your immune system takes a little bit of a dip. And anyone who has a little immunodeficiency of some sort will have candidiasis. So even patients who are diabetes, HIV positive patients, especially those we see who are pregnant and are HIV positive, we do advise them that these are some of the common ailments they're going to have.
So they can prepare psychologically.
You prepare them psychologically. Always, whenever you see your doctor, I don't get offended by patients who go to Google and say, I have this list of things I'm going to ask the doctor. You should ask your doctor, I saw this, what will happen if this happens? What happens if this happens? Another common ailment is insomnia. Some women just can't find the right position to sleep. So when you are not pregnant, you have a specific position you sleep. All of a sudden, you're telling your husband, I want to be on that side of the bed. It's more comfortable and not this side of the bed. I've seen this S-shaped pillow women have bought. Some of them have said it does help. I usually say, if it's safe, ask your doctor if it's safe to try. Can I try this, Daktari? If it is safe, really there's no harm in trying it. We will not give you medication for trying to sleep. Absolutely not. So we may tell you take a warm drink. Some, like we used to give children warm milk and say to help them to sleep.
Yeah.
Try hot chocolate. Try a warm bath. Try stretching exercise, see if it's going to help you. But there are many things, as long as it is safe. Ask your doctor, can I try this? I've seen that this I can try. And they'll confirm whether it is safe for you to try or not.
I'm wondering, speaking for many moms, for myself, I remember in my third trimester, the insomnia was way worse compared to the first and the second one. Is this common? Or, of course, maybe it varies from mother to mother, but yes. Is it worse in a particular trimester?
Yes. And majority have had this third trimester because as the belly grows really big, you imagine when you're 39 weeks, you're carrying almost about 7 kilos just here, or 6 kilos, and you're trying to turn them to the other side because you're tired of sleeping on one side.
That's a lot of kilos.
That's a lot of kilos to turn. So it gets very uncomfortable. So the sleeping position is, and when you turn and you get uncomfortable, automatically you lose sleep. When you lose sleep, now trying to get back to the sleep, so you sit up, you wonder what to do. A few in first trimester, second trimester have complained of loss of sleep. Yeah. We will not give you medication to sleep. Absolutely not. So we will encourage you to do either exercise or stretching something, take something warm, a warm bath, soak in a warm, have a massage, husbands. Tuliza bibi alala vizuri.
I'm sure they hear you loud and clear.
I hope they're hearing me.
So let's move on to prevention, preventing some of these common ailments and complications where we can. If you want to start with Abdallah's question, thinking that if he refrains from, having intercourse with his wife, then everything is going to be okay.
Again, pregnancy is not a sickness. You can have sex until the day she is in labor. There are certain complications in pregnancy. So, for example, if, your waters break, premature rupture of membranes, where the waters break before the time of labor or bleeding. There are certain situations we will advise you not to have intercourse because you may cause complications. If she has a placenta previa, the placenta is lying in the lower part of the uterus. So there are certain medical conditions you will have in pregnancy, then we will advise that you don't have intercourse. Otherwise, there is no absolute reason why you should not have intercourse up to when she's in labor. And then after pregnancy, we tell you normally 6 weeks after pregnancy.
Right.
So there is no complication. There is no harm to the baby. When it comes to positions, it is up to the two of you to agree on what is comfortable for the woman.
Yes. Comfortable for the woman,
of course.
Woman,
yes. At this point, the priority is the woman. Of course. Because with the pregnancy, then lying on her back may become very uncomfortable. So it is them to discuss which positions. And, oh my God, there are many.
Daktari.
Yes.
All right, let's move on to The common ailments that we had mentioned at the beginning, if there's any way we can prevent any of them, if at all. Bloatedness, is there particular foods we need to, to stay away from when it comes to constipation as well? Heartburn.
Yes.
What are your pointers for, these common ailments?
So for nausea and vomiting, nutrition is so important for the pregnant woman. So if you're vomiting, you're not able to retain, go and see your doctor.
Right.
Some patients don't have it so bad, so there's some certain medications we can give them that may either help with the nausea, others to help with the vomiting, others may require admission. Because if you're very dehydrated and you can't retain even water, we may have to give you intravenous fluids and have to give you drugs to help with that.
Right.
Others have very bad heartburn, they're vomiting, and especially if vomiting is accompanied with blood, that's a danger sign in pregnancy.
You need to see a doctor.
And you may need to be admitted, because now we may have to give you other drugs. And may need to call a physician to say she may, because we're afraid you may develop ulcers, which rarely happen in pregnancy. When it comes to bloating, listen to your body. You'll be able to tell which food. So many patients tell you either dairy is giving me. So I tell them, try stopping dairy products. Try stopping skuma wiki. Try stop eating beans.
Beans?
Yes, beans. People get gas because of beans. See what you can avoid, and if it helps. You will not be able to pick it immediately. So and someone tell you, oh, if I don't eat skuma, where am I going to get my greens from? There are so many sources of greens. You have spinach, you have the traditional vegetables.
Yeah.
There are many sources.
Yeah.
Remember also we do supplement, especially women in certain areas in the country whereby malaria is endemic. But ideally all women should have iron supplements. We do check your hemoglobin levels,
right,
but there are those who will require iron supplementation.
Okay.
When it comes to heartburn, we will give you medication that can to ease the heartburn. If there are foods, beans, also those are the ones that can also give heartburn. Dairy products, we tell you stop one and then stop one for a week and see, am I getting better?
Yeah, see how your body
stop
reacts.
Another one and then see if it's getting better. When it comes to constipation, I normally encourage patients to eat a lot of fruits and vegetables. Now, especially vegetables, greens are great for constipation. Fruits that have skin that you can eat. So like I tell people, if you want to blend a mango, blend with the skin or actually chew on the skin. Oh, interesting. Because the skin of fruits is not digested. So when it comes with the stool into the large intestine, it actually draws water into the large intestine and you're able to actually pass stool easily. The other common ailment, I tell people, if you have frequent UTIs, urinary tract infections, cranberry juice.
Cranberry juice.
Lots of water. You need to do more than 2 liters of water per day, because we don't want to subject you to antibiotics all the time. Unless there's a clear infection that the lab tells me this one requires treatment.
Right.
Otherwise, things like cranberry juice, thrush, buying yogurt in the supermarket, and these days you buy yogurt that has probiotics. Probiotics replace the bacteria that have been messed around with in the system. So you don't go and see your doctor, but it's not all the time that you require medication.
Okay.
Other common ailments like swelling of the feet. When the uterus is growing, it presses on these veins, so automatically your legs are going to swell. It doesn't happen to everyone. I encourage women to walk. I encourage women to exercise. If you're at home, you tell your husband, baby, let a pillow, put your feet up, raise them up, and then recline to some, so I think you should buy a recliner for your wife, Swelling of feet, but the important thing about swelling of feet is go to the hospital and get your blood pressure checked.
Very important.
Yes, yeah. The other common I've talked about insomnia is find ways of...
Doctor, before you move to insomnia, just on the legs, leg cramps. Any way we can prevent, for some women it happens, that painful pull. Yes. I don't know if there's something that...
because of what happens is what is edema. So as the uterus is pressing, you get fluid. Blood is not flowing back as easily as it was before back. So there's going to be a bit of stagnation. So if you see someone's legs and they take pictures and tell me, look at my legs, they look like an elephant's legs. If your blood pressure is normal, you're not diabetic, I'll actually tell you, imagine it's okay. And when the baby is born, it takes time. And next thing, your legs are back to normal. So they really don't have to worry about it. You have to always encourage your patient not to be worried about. But they have to consult you. Please, if you're not sure about something,
consult your doctor.
Consult your doctor, and your doctor should be accessible and available to tell you. And either tell you that it's going to be okay or there's a problem. Okay. Yes.
Why are leg cramps common at night?
So most women will tell you that, some of them will tell you that my legs swell when I'm asleep. Others tell you my legs will swell during the course of the day. If your blood pressure is normal, really we're not sure why they'll swell. Of course, if your leg is swollen, some people will tell you, it's not really cramping, but they'll tell you about pain, like heaviness. But they won't tell you I'm feeling pain, tell you my legs are feeling heavy. Lift them up, put them up. Okay. Yes, yeah.
Is there any treatment for high blood pressure? gestational diabetes,
Yeah.
the other complications when it comes to, you know, pregnancy and being healthy during that time.
So if you are at risk of having diabetes or hypertension in pregnancy, if you've had them in a previous pregnancy, we normally advise do not get pregnant again before we see you. So we need to see you first and then confirm. In your previous pregnancy, you had high blood pressure and diabetes. Then there are certain things we need to do before you're pregnant.
Right.
Ideally, pregnancy should actually be planned before you conceive, but majority of us were conceived without being planned. But ideally, a good healthy pregnancy should be planned pre-conception. So you say, my partner and I would like to get pregnant. Okay, let's go and see a gynecologist. But that rarely happens. So those particularly who have had complicated pregnancies before need to see their doctor before they plan to conceive again.
Okay.
Majority of the times it doesn't happen.
Okay.
So if it's high blood pressure, normally there are studies that have shown that there are certain supplements you can be put on to prevent high blood pressure. High blood pressure in pregnancy is a problem of the placenta. There's inflammation in the placenta. So we normally put them on aspirin and calcium supplements. If you are overweight, I will advise you to lose weight. If you've had miscarriages and you've had maybe an abnormal birth, maybe a baby who was born with defects, we put you on supplements like folic acid before you get pregnant. If it is diabetes, I'll consult the doctor who was seeing you for diabetes and say, have her sugars been controlled? If they're controlled, then we say now she can get pregnant, and then co-manage her with that doctor.
Right.
When you get high blood pressure in pregnancy, then we may start your treatment depending on the type. There's mild, moderate, and then there's actually no. It's actually right now there's no moderate. There's mild and severe.
Okay.
So there are those we just put on high antihypertensives, and then follow you up with blood works. If you have severe preeclampsia, then we have to keep checking your kidney function tests, your liver function tests. We have to keep checking your blood, what we call is a full hemogram, to check that you're not having organ failure that could lead to complications.
Okay.
Yes.
So, Dr. Hari, any last piece of advice when it comes to common ailments during pregnancy? If there's any one or two last things you can share with our audience.
I normally tell women, first of all, look forward to enjoying your pregnancy. I tell women, you will always hear stories from your friends. My pregnancy was like this, my pregnancy. Do not feel threatened by someone telling you, my tummy was showing earlier. Every woman's journey is so different. But whenever you have something you're not sure about, I don't get offended by patients who Google and come and tell me, I read this on Google. Then I tell them I'm here to bust your myths or tell you whether that was right or wrong. Consult your doctor and keep up with your antenatal clinics and be healthy. Be healthy, but enjoy your pregnant. And my encouragement is to husbands is support. Yes, she's gonna have mood swings. It's okay.
Support her.
Support her
all the way.
Buy her dinner. Don't treat her as if she's a sick person. If you are taking out for dinner, if you like hiking, you can still go hiking. Swimming, whatever activities you enjoy together. She's not a sick person. She's just pregnant. Yes.
Thank you, Dr. Kakuti.
Thank you so much.
It was a pleasure having you.
Thank you.
It was an absolute pleasure.
An honor.
And with that, we come to the end of today's episode of Today's Parent, where we were talking about common ailments during pregnancy. I hope you found it to be very insightful, the pointers that Dr. Kakuti has shared. If you have any more questions, please send us an SMS and we'll find a way to connect you to Dr. Kakuti. I have been your host, Christine Casina, and this has been Today's Parent, where we normally shoot at Little Cribs, the home of fun, exciting, and durable kids furniture. So if you're looking for exciting, different kind of kids furniture, come over to Little Cribs so you can see what is different over here. And if you're looking for parenting resources like pregnancy information that will help you during your pregnancy, go to www.supermamas.co.ke. We look forward to having you next time. Thank you for tuning in.